I'm Dr. David Cotter, a board-certified dermatologist practicing at Las Vegas Dermatology in Las Vegas, Nevada. Where not only do I see patients, but we also run clinical trials, mentor medical students, and train residents. Today, I'm excited to talk about not just the clinical presentation, but also the treatment landscape for a disease that's so bothersome for so many of our patients, Prurigo Nodularis. And to kick it off, I just want to share a little story. I was seeing a young woman sometime last year in the summer, and she walked into the office, 115 degrees outside, wearing jeans and a sweatshirt. And typically, people are only doing that in my clinic if they want to cover something up. Turned out she was there for a prurigo visit. When she took off her clothes, she certainly had severe prurigo nodularis, which means by definition, an abundance of lesions, over 100. She was having 10 out of 10 itch. And I knew at that moment we needed to do something to help her. She'd actually been on other medicines in the past, including biologics, IL-4, 13 inhibitors. And I talked to her about nemolizumab, which was pretty new at that point in time. And she went on it right away. We started on sample same day, and she came back every month for follow-up. And just like what we see in Galderma's Olympia trials, she did very, very well. She was actually an overachiever. In the clinical trials, about 25 to 40% of people get to clear, almost clear by week 16, which is the primary endpoint in the Olympia trials. She was 100% clear by week 16. So a really great story of how this medicine works in the real world, and also couples to the clinical trial data that shows that it is generally effective in most patients. And in the Olympia trials, in the long-term extension, we're talking about people continuing to improve the longer that they're on the medicine. For an itch reduction standpoint, people have itch reduction as early as day 2. We're talking about maybe 1 in 7 people having a 4-point reduction in their itch severity as early as day 2. But as we follow those patients out in the LTE, all the way out to 2 years, their medication remains durable. And at that point in time, nearly 100% of patients have a 4 or more point itch reduction. We're talking 92 to 94% of people having a 4 or more point itch reduction out to 2 years. We're talking about 80 to 90% of patients having anywhere from 76 to 100% healing of their prurigo lesions. Overall, it's been a great medicine for so many of our patients, and it does seem to respond in the real world the way that it looks like in the clinical trials. When it comes to dosing for nemolizumab, it's just about as easy as it can be. Patients are started on an initial loading dose of 60 milligrams, and depending on their weight, they continue on every 4 weeks at either 60 milligrams or 30 milligrams. The weight cutoff is 90 kilos. So for patients that are 90 kilos or more, they stay on 60 milligrams every 4 weeks. For those that are less than 90 kilos, it's 30 milligrams every 4 weeks. And currently the indication is down to age 18. So if you've got an 18-year-old patient with PN, you can start them with 60 milligrams nemolizumab and follow them up every 4 weeks with a subsequent dose, 60 milligrams if they're over 90 kilos or 30 milligrams if they're under 90 kilos. From a safety standpoint, this medication is a no-brainer. It's a point-and-shoot type of medicines. There's no box warnings. There's no required lab monitorings. It's very well tolerated. We don't see signals for conjunctivitis. We don't see signals for facial dermatitis. There are low rates of things like headaches and mild arthralgias, which does seem to actually come through into clinical practice, but the rates are very low and it's typically mild. Some strategies we use in our office to mitigate that is to just have people use a little Tylenol or ibuprofen as needed should something like that arise. And I've yet to have any one of my patients, of the many that are on Nemluvio, have to stop the medication because of either headaches or arthralgias.